Hi there, Jim Broyles here. So I want to spend just a couple of minutes talking about acid-suppressing drugs and why they might be a bad idea for your health. Chances are they could be adding fuel to the fire and just causing a lot more damage and harm in the long run. And I know this can be a very controversial topic because the use of antacids such as Prilosec, Nexium, and Tums is widespread. Half of American adults have used antacids, and they are the third most common over-the-counter medication. Most people, and maybe yourself included, take these drugs to relieve symptoms of heartburn, indigestion, acid reflux, and GERD. And oftentimes these medications feel like they're helping. You may find that your symptoms are reduced or eliminated. However, they're likely not treating the cause. And in fact, they may be making the cause even worse. And not to mention, these drugs are intended for only short-term use, but the median duration of use is 20 years. So these drugs are not being used appropriately either. Now, the initial theory behind heartburn and acid reflux was that the stomach was producing too much acid and causing these symptoms. And, that's why they bring in acid-suppressing drugs to help with that. But unfortunately, this is not typically the case. More often than not, the issue is an underproduction of stomach acid. And this underproduction of acid can actually contribute to a whole host of problems, which happen to include heartburn, acid reflux, and indigestion. Now, there are also some very terrible side effects of using antacids. Just to name a few, there's an increased susceptibility to pneumonia. And this is probably because antacids reduce stomach acid, which is a powerful germ and pathogen killer. And this information was actually found by Dutch researchers in a study of more than 300,000 patients, that there is an increased susceptibility to pneumonia. There's also an increased risk of dementia. A 2007 study showed that a 250% increased risk in African American patients over 65 years with continuous use of antacids. There's a 44% increased risk of hip fracture, which was revealed in a 2006 study. And this study looked at patients after only 1 year on Prilosec and Prevacid, and it showed a 44% increased risk of hip fracture. Additionally, with certain antacids in the class of H2 agonists, such as Tagamet, common side effects are breast development in men and headaches, which most people don't want. So, and those are some of the common side effects. Now, just to break down digestion at a high level and how things work once we eat food. So as food enters our mouth, we produce two salivary enzymes called amylase and lipase. And these enzymes are needed for the digestion of carbs and fats. Now from there, the food goes down the esophagus into the stomach, and at that point, a hormone called gastrin stimulates stomach acid production, and that stomach acid is called hydrochloric acid. And the role of hydrochloric acid, or HCl, is absolutely critical to healthy digestion. Just a few of the things that's important for are the fact that it assists in protein digestion. It converts pepsinogen into pepsin. It protects against orally ingested pathogens. So, we encounter pathogens on a daily basis, but our bodies are designed to help fight those off. And one of the tools that our bodies use is stomach acid. So as food enters our mouth, there may be a pathogenic bacteria or a parasite or a fungus on that food, but ideally it would be killed off in our stomach with all of that stomach acid. But if you're not producing adequate levels of stomach acid, then there's a very high chance of that pathogen passing through the stomach into your intestines, where it can manifest and grow, and then you develop a gut infection. It helps prevent against bacterial and fungal overgrowth. So things like small intestinal bacterial overgrowth are strongly linked to low stomach acid production. It also aids in the absorption of many important vitamins and minerals. So things like B12 and folate, calcium, magnesium, and iron are all essential for your body, and adequate HCl production helps your body absorb those vitamins and minerals. So if you are not producing enough stomach acid, then there's a very good chance of malabsorption of essential nutrients. The production of hydrochloric acid also stimulates the release of mucus and bicarbonate from mucus cells, which help protect the stomach lining from erosion. So HCl is extremely critical to healthy digestion. Stomach acid is needed to make the contents in the stomach very acidic before it moves through the rest of the digestive tract. So once the pH in the stomach is low enough or acidic enough, ideally below 2, then gastrin production is shut off, which signals hydrochloric acid production to stop. Now, if the pH acidity isn't low enough, then gastrin production is not shut off and the parietal cells continue to secrete HCl. This can actually lead to ulceration in the lumen, which we definitely want to avoid. Now, as we age, our bodies just produce less and less HCl and pepsin. It's just a natural thing that happens, and that's really why we might start to feel these uncomfortable symptoms after eating as we're aging, and it's because our stomach acid levels are starting to drop. And you may especially notice this after eating high protein meals. Now, some common symptoms of low stomach acid are bloating or distension after eating, diarrhea or constipation, indigestion, excessive burping and or bloating, flatulence, a sense of fullness during and after meals, poor appetite, offensive breath, bad taste in your mouth, partial loss of taste or smell, difficult bowel movements, difficulty swallowing, unintentional weight loss. If you're a picky eater, that can be a sign of low stomach acid production. If you have spoon-shaped nails, so if you have like indentations in your nails, that can be a sign. Sores in the corner of your mouth and a smooth tongue. Those are all symptoms of low stomach acid. And there are actually many conditions that are associated with low stomach acid as well. And these include, there's a long list, Addison's disease, alcoholism, anemia and pernicious anemia, arthritis and rheumatoid arthritis, asthma in children specifically, autoimmune disease, celiac disease, stomach cancer, depression, dermatitis, diabetes, eczema, gallbladder disease, gastric polyps, gastritis, hepatitis, hyperthyroidism, lupus, osteoporosis, psoriasis, parasites, as I mentioned, gut infections, SIBO, small intestinal bacterial overgrowth, rosacea, Sjogren's, ulcerative colitis, urticaria, and vitiligo. So a lot of different conditions are associated with low stomach acid. Now, the biggest indicator of low stomach acid is gas. And so if you experience gas after meals, then that is a good sign that you're not producing enough stomach acid. And basically what that is linked to is the fact that the colon is too alkaline and acidity needs to be increased. Now, you may know the many symptoms now associated with low stomach acid, but now you may be wondering, what do you do? Now, there is a diagnostic test for low stomach acid. It's called the Heidelberg test, and it may be something you want to ask your doctor about, but it can be costly. So you can actually do a simple test at home, and you do this by supplementing with betaine HCl, and betaine HCl is basically hydrochloric acid. And it can be extremely helpful in providing adequate stomach acid and easing your digestive problems while also helping you restore your stomach acid levels naturally. And I recommend getting betaine HCl with pepsin. And the way you would do this test is to take one capsule with a protein-containing meal. And one thing I want to note is that you do not want to take betaine HCl without protein because hydrochloric acid really helps with the digestion and assimilation of protein. If there's no protein in your meal, then you may experience uncomfortable symptoms after taking it. So what you can do is with a protein-containing meal, perhaps your dinner, take one capsule halfway through the meal and then see how you feel. If you don't feel anything, then chances are you've got low stomach acid. If you do start to feel like a burning sensation in your stomach, it may mean your stomach acid levels are adequate, but definitely more investigation would be needed. But again, if you don't experience any symptoms, then that's a good chance that your stomach acid levels are low. And what you would want to do is test things out and find your maintenance dose of betaine HCl. So you took one capsule with a protein containing meal, felt nothing. So maybe next meal with protein, you try 2, see how you feel. If you still don't experience any burning sensation in your stomach, then try 3 and work up from there. Once you do experience that slight burning sensation in the stomach, then that's when you've had too much. You want to dose back down to the previous dose, and that'll be your maintenance dose for a while, and see how that works for you. You should find that it alleviates some of your uncomfortable digestive symptoms. So hopefully this will help you out a little bit, and definitely something you may want to talk to your doctor about as well. But I hope this information was useful and helpful for you. You can always visit my website and look through my blog on other articles regarding IBS and digestive wellness, specifically in regards to HCl and stomach acid. There are a couple of articles on there, so you can search for those and read more about this information. But again, I hope this was helpful, and we will talk soon. Thanks.